All right, the article that I'm going to review is titled Weight Supported Treadmill versus Overground Training for Walking After an Acute Incomplete Spinal Cord Injury. All right, so this study was done with 146 subjects from 6 different regional centers within 8 weeks of their spinal cord injuries. This was a single-blinded, multi-center randomized control trial. The subjects were graded on the ASIA scale as either ASIA B, ASIA C, or ASIA D, with the levels of injuries being anywhere from C5 to L3. In addition to the previously mentioned criteria, each of these subjects also had a functional independence measure of locomotion score of greater than 4. The subjects with an injury in the cervical area down to about T10 or T11 area were designated as the upper motor neuron group, and the subjects with a T11 to L3 lesion were designated as being the lower motor neuron group. And you can see in the table below, it shows you kind of how each of those groups were split up for this experiment. So for the intervention in this clinical trial, all of the participants were split into the 2 groups that were previously mentioned. One group received body weight supported treadmill training for 1 hour a day, 5 days a week, and the other group received their gait training over ground, also for 1 hour a day, 5 days a week. These interventions went on for a total of 12 weeks. All right, so once we get into the results of this study, we see that there was no significant differences between the body weight support treadmill training group and the overground gait training group. There were no differences noted after the initial 12 weeks, and there were also no differences noted after a 6-month checkup with the participants. One thing that was mentioned that could have skewed these results is that the study had an unexpectedly high percentage of ASIA C subjects who achieved functional walking speeds regardless of what the intervention was. So that is something to keep in mind when we look at the results from this specific study that I'm reviewing. As far as our clinical implications from this study, the biggest takeaway that I think can be drawn from this study is that body weight support treadmill training and overground gait training are both effective in the presence of an incomplete spinal cord injury. One of the things that could be a potential barrier for bodyweight support treadmill training is the amount of manpower it takes to get it going and also the price of the equipment. So it's pretty encouraging knowing that you could get similar results without the expensive equipment.